So marketing to me is not about hype or interruption or look at me, um, look at how great I am. It's about attention, trust, and connection. So, like, what does that mean in healthcare marketing specifically? I see it as the ethical practice of helping people find the right care at the right time from the right provider.
This episode explores the role of marketing in behavioral healthcare, including strategies for patient engagement and how providers can improve visibility and access to care.
Good afternoon, everybody. I'm Dr. Brandy Biglow. I am the special host for today's episode. I am joined by Dr. Jeremy Henderson-Teelucksingh of Indigo Path Collective and Kat Vasquez of Renovation Integrative Health. Today, we're going to be talking about the Doctor of Behavioral Health, and we're going to be including into that piece marketing and marketing strategy. So we're going to start with Kat first, and we're just going to kind of sing-songing our way through this. So first, Kat, can you share your journey into marketing and what initially motivated you to see it as an essential part of your work in healthcare? First part. Second part, how do you describe to people what marketing is in general and how healthcare marketing is specifically?
Okay, so my journey into marketing, it kind of started with a practical goal, right? It was first about financial independence for me and my people. Because, honestly, they don't teach us that in school at all, right? And then we start entrepreneurship and life, and we learn the hard way. Healthcare actually just felt like the niche itself kind of fell into my lap. It's not something I necessarily planned to specialize in, but it found me. So, like a lot of people, for me, like navigating the system has been a lot, y'all. It's been frustrating, it's been overwhelming. It's like consistently asking, why is this so hard, right? And then at the same time, through my wife, Dr. Brandy Biglow, um, I kind of started meeting a lot of incredible providers that were like doing truly groundbreaking work. They were tired of the status quo and they want to change it. But the issue is not like their actual work, what they're doing. What they're doing is remarkable, but they're not very visible. They know the work, they're experts, but they're not marketers. And so as a result, like I said, they're just invisible. And so I started by helping one provider, then another, an email here, a question there. And so I quickly realized that, yeah, this is my lane. So giving, like ethical healthcare providers like Dr. Brandy at RIH and other clients, um, then they can actually just cut through the noise. I'm helping them support them through that, right? So to answer about marketing specifically, right? When I talk about marketing, I often reference Seth Godin. I'm sure you guys have heard of him. He's like the father of marketing, and he describes marketing as the generous act of helping people solve problems and help them become who they want to be, right? It's about a transformation that they're seeking. So marketing to me is not about hype or interruption or look at me, um, look at how great I am. It's about attention, trust, and connection. So, like, what does that mean in healthcare marketing specifically? I see it as the ethical practice of helping people find the right care at the right time from the right provider. And so I think by providers clearly communicating the value that they provide, by building trust and reducing confusion in an already overwhelming system, that's when marketing is done well. And that's when it can actually become an extension of the care itself. It's not against it, but it's going with it. Because honestly, an incredible provider or program or tool that you're selling that no one like finds out about is not improving outcomes. It's not doing anything for anybody. So we can't call it remarkable.
True, very true. Dr. Jeremy, what do you have to add to that same question?
Well,
How?
yeah, and I'll just, I think Kat nailed it really well when she said the right provider, the right time, the right, all those things need to line up, rather than the right provider with the right who takes the right insurance, or a provider who takes insurance, right? So there are kind of these stumbling blocks that are inherent in the type of healthcare system that we work in. But I first started in marketing in 1991 when I entered my undergraduate degree, which is in public relations, so journalism and public relations. And I since then went on and worked internationally in universities, trying to market to students, to military students, actually abroad, and then have always had a career that was either in marketing or marketing adjacent. So a lot of what I've done over my career is in employee communications, which is one of the audiences that marketing tends to understand as important, because employees build your brand, and they're the ones who can really make or break your customers' experiences. So from my point of view, when I think about marketing, what is it, right? How do we explain it? It's really an umbrella term that includes a number of different practices that sit underneath of it, that work together to pull folks into the company in some way or another, and to create an engagement with them that is enduring over time. So this isn't a one-off. This is something that a relationship that the company builds with its consumers, supporters, stakeholders, all of these different audiences. But they do it marketing is done in such a way that it's universally understood, even if the audience is different. But it's pulling those relationships in and bringing people together.
Wow. Thank you guys for that amazing definition and understanding of what marketing is, and for Dr. Jeremy of giving us and letting us know that it's an umbrella term. So coming back to you, Kat, right? How has intentionally applying brand strategy, which I know is your specialty, within your marketing strategy into the organization informed the way you serve patients, partners, or the broader healthcare system? And with that, can you provide a specific example of how like clear messaging, positioning, or visibility directly improve access, engagement, or outcomes, which you kind of mentioned a little bit before?
Yeah. So I think that like for us, intentionally applying brand strategy has completely changed how we serve, not just how we market, right? So like it comes from the service first. So at its core, brand strategy is really about clarity. So the simpler and clearer that we communicate who we are, what makes us different, and who we're for, I think the easier it is for the right people to find us and say, this is for me. So brand strategy just focuses and forces us to answer foundational questions. So like I mentioned, who are we? Who needs to know, right? Why should they care? And how do they find us? So I think that when you answer those honestly, everything downstream gets better. So specifically here at Renovation Integrative Health, that clarity shapes every decision we make. It informs how we speak to patients, how we partner with organizations, what opportunities we say yes, and more importantly, what opportunities we say no to, right? So our mission is to support the world in achieving work-life harmony. And so that becomes our filter. So if an opportunity might look great on paper, but it doesn't align with who we serve and why we exist, or we don't, we're just not gonna take it. That I think that this alignment creates trust, consistency, and a much better experience for the people on the other side of the brand, right? Our patients. So I think if I think of a good example, right, a very tangible example of this visibility, we're intentional about our messaging, our positioning, the SEO, and we always ask people how they found us. And so there was one organization was specifically searching for a BIPOC speaker in the well-being and burnout, theme, uh, space, yeah. And so because our messaging clearly reflected who we serve and what we stand for, they just found us organically through our website. And so that led to meaningful impact, a strong partnership, and work that aligned deeply with our mission, and a possibility of more work and collaboration with them in the future. So clear branding for us in this aspect didn't just improve the engagement, it improved the access. And in healthcare, access changes outcomes.
Well, I think again, Kat's, of course, saying all these things brilliantly, and the one area I'd add is that there are aspects of the client's journey that can be very confusing for them when they are trying to figure out how to interact with a company, right? So, in my case, for example, I offer clinical mental health counseling, leadership coaching, and organizational consulting. Those three things do not normally sit together in one business. It's just not the norm. But when you understand the positioning, like Kat's talking about, kind of the understanding the why behind what we're doing, it's really about how do we bring wellness everywhere? And that's at home, that's at work, that's in our communities. And so the brand strategy also helps the client to understand how they interact and where they interact with the business so that they can have, so that access isn't blocked by confusion, right? Because confusion, should I be with this company or should I not work with this company? That confusion can come through a lack of brand clarity. So having a really clear understanding, as Kat said, about what your company is, what does it solve, what's the issues that it's tackling, and who is it for, makes all the difference for people who actually want to engage with you.
Awesome. Thank you. You guys are doing it right. Okay, we're going to start with Dr. Jeremy this time. Behavioral health providers often face unique challenges when it comes to marketing, whether it's stigma, privacy concerns, or just being overshadowed by traditional medical services. What obstacles have you encountered and how have you navigated them? First part. Second part, how do you address concerns like ethics, compliance, or the fear of commercializing care when it comes to marketing?
I think we could probably spend about 4 more hours talking about this question alone.
Yeah, we
because
could.
It's a very complex, but maybe I can tackle it backwards. I think first, the commercialization of care is it's a little bit touchy to even think about it in our space, because what are we doing as behavioral health providers? Well, we're getting in there. We have this depth and intimacy that we create with our clients to help them achieve some degree of wellness, whatever that goal is that they're hoping for. And so there's a lot of privacy at stake. And the experience that a customer, a client, a patient has with us doesn't feel like a transaction, because it's not. It's a relationship. In mental and behavioral health, it's the only place in all of healthcare where it's a brain treating another brain. So that commercialization piece can often feel kind of icky for behavioral health providers, because they're marketing a relationship with them, well, we have a lot of social stigma against that in general. But the reality is, it's a business, right? What we do is provide a service, and that service is in exchange for remittance. And so there is a transaction that does occur. So that it creates a complexity within mental and behavioral health marketing, because we both want to connect with someone without having them feel stigmatized for connecting with us, when we live in a society that does stigmatize mental health, behavioral health, as something wrong with the person, rather than just a cluster of cells responding or expressing itself in the context of environment. So it becomes tough. There are instances, a lot of instances, of healthcare providers in our space who kind of go after the negative side of it. Like, you're feeling down, sad, sick, ill, anxious, depressed. And while those are all real, those are problems that we're solving, there's also the other side of it, which is you can live a life of fulfillment. You can live a well life, right? Because I don't know that people always need to be reminded that that's what their experience is, but offering them the other side of it, I think, is pretty grand. The other thing I'll just say, just briefly, and then throw it over to you, Kat. But in all of marketing, one of the best tactics that we can use is a testimonial from a customer. In behavioral health, ethically, we are restricted from using those testimonials. Now, there are some ways to do it. I'm not saying never do it, but it's difficult to be able to do that. And so we have to market then in a way that is really, truly, going back to the idea of brand, really, truly about the brand. And, well, who's the brand? It's the provider who ends up being the brand. And so there are some nuanced elements of this that are really about how we as providers infuse ourselves into the brand, our approach, and how we work, so that the marketing pulls the right people to the right provider, as Kat was saying earlier. But that's because they're already experiencing your business through the marketing, and then they get to you and they have a consistency of experience, and that helps to accelerate relationship development. So for us, there are some nuances that other businesses don't necessarily have to achieve.
For sure. Anything you want to add, Kat?
So yeah, I what I heard from Dr. Jeremy is I just kind of wanted to simplify it, right? I think that it starts with an attitude change from the provider side. So I think that behavioral health focuses definitely faces like unique challenges in the marketing with the stigma and privacy concerns, HIPAA, and like you said, the fear of commercializing it. But if you take it back to the definition that I provided about healthcare marketing, is the ethical practice of helping people find the right care at the right time from the right provider, right? So if we're clearly communicating value, building trust, and reducing confusion, uh, then I don't see it so much in that we're trying to commercialize it, but more that we're providing that service and that extension of the service, as I mentioned. Yeah, like Dr. Jeremy, there's laws that we have to follow, period. There's no going around it, right? But if you think about it historically, I think part of the reason why we are in where we are today in healthcare has been because of this silence and this silo that has been allowed to happen. So everything has been just kind of quiet. Providers didn't worry about visibility or reviews or this or that. Insurance companies operated in the shadows. Nobody even understood what were their like criteria, right? Uh, Outside of providers, of course, I'm talking more patients and stuff, and even providers sometimes. And so I think that's why patients have limited recourse, you know. And today, what we're seeing is by putting ourselves out there, we're seeing more accountability through that visibility. I think that the clear ethical marketing helps the right patients. As I said, find those right providers, it sets the expectations, and then it builds trust. And I don't think it's about commercializing the relationship, but that building trust from the beginning so that that relationship can be built. Um, so I don't think I think it's a disservice not to be clear and to tell them that if we want to change healthcare, we have to be willing to say so and say so responsibly. And guess what? That's marketing, you know. And when it's ethical, when it's intentional, when it's patient centered, then it doesn't commercialize care. I think it protects it. It protects it.
Okay. Y'all are hitting all the good ones. Okay. So we're gonna start to wrap this up. We're getting almost at our time. However, I want you both to think about this. This is a podcast that's directed towards healthcare providers, specifically doctors of behavioral health. And a lot of times we're a little bit more invisible. We're not as known as nurses and things of that nature. And if someone's watching this podcast and they say, man, I don't have any idea where to start, or if they have that mindset of, I don't have time for marketing, it's not in my budget, it's not something that I do, because a lot of times in our field, patients do come to us. We just get on a platform, a directory, and then we get patients, right? But for that person who wants to stretch, but they don't know where to begin, what is one practical first step that they could take today? And I'll go with Dr. Jeremy for your answer first, and then we'll come to Kat.
Yeah, it's a really good question, because what my experience is when I have worked with behavioral health providers is that there's a resistance to marketing. There's a discomfort. There's a discomfort with the idea of marketing. And at the end of the day, any time you tell someone what you do in the world, that's literally marketing. You are literally talking to them about what you do. So we can make marketing as incredibly complex as we want to, or incredibly simple. There's a spectrum that is available. I would recommend or suggest the step right now for someone who's just putting their toe in the water is to keep it incredibly simple. And the easiest way is through relationships. So let's say you don't want to put up a website. You don't want to have a whole set of courses where you're teaching people in an LMS and all the different things, all this stuff. Well, you could call a doctor's office, right? You could call a doctor's office and talk to them about partnering up. You can call other behavioral health providers. You can call the local hospital, let them know that you're available. So there are these steps, like literally just talking to people is marketing. And so if you just want to do something simple today, make a phone call, introduce yourself, go to a conference, an event, pass out some business cards. Those are very simple to create. Another step might be putting up a website. I always say that the websites today are like, digital business cards, right? They're the place where people can go to get a feeling for what you do and what you deliver. And there are so many platforms that make creating a website incredibly simple. So everything doesn't have to be complex, but that, to Kat's point earlier, is changing your mindset about marketing. It's taking away all the things that you think you don't know and just moving them off your plate and focusing on the things you do know, which is what you do. You know what you serve. You know how you serve, and being able to express that clearly and cleanly to folks. Well, that's an easy first step.
Cool. Nice. Kat, do you have anything to add to that?
Yeah, so I mean, like first, I want to say you don't not have time to do marketing, right? As Dr. Jeremy said, marketing is just simply telling people about what you do, why, and why they should care, right? So I think if you're overwhelmed and you don't know where to start, I'm gonna give you just one thing for the people that have a hard time with putting themselves out there, as Dr. Jeremy said, right? Because we have the people who are like, internet, social media, no. And then you have the people who are like phone calls, no, right? So here's a tip for those who want to go more of a digital route. So grab a piece of paper, no tech required right now, and just answer a few basic questions. Just a sheet of paper. And so it's really, I don't know if you guys heard of Donald Miller's storygram framework and Alan Dibb's one-page marketing plan. So here's what you write down. Who do you help? What problem are they coming to you with? How do you help them? And what does life look like after working with you? That's it. Just clarity before complexity. Simple as Dr. Jeremy said. When you get clear on the basics, the right patients are going to start to self-select. So I want you to just, after you write down those answers, if I'm going to give you a tip too, just take that and slap it anywhere visible. So do you have a business Facebook? Do you a simple one-page website, as Dr. Jeremy said, is very simple to do. I don't need you to invent the world. Literally, it could just be the answers to these questions. Slap it on your Psychology Today or whatever professional directory you use, and just be clear, be human, be specific. Do that, and I guarantee you, you're going to see more alignment. You're going to see better inquiries, and you're going to see better outcomes. And include a picture of yourself, please. People like people. Okay, so if you want them to trust you, just a good picture of yourself with those things, and you'll see a difference, because marketing doesn't have to be this big thing to be effective. It just has to be clear. That's it.
And I'll agree with that statement. I remember when I had a picture on a directory, and I will often ask people how they found me or what drew them to me. And I was like, oh, your picture. You were one of the first people that had a picture. And it was like, oh, I like your smile and your eyes are kind. But really, it was, I had a picture. There were so many people, they went pages after pages after pages, and the providers didn't have a picture. And so the fact that they could see my face was very helpful in them determining whether or not they would call me. And then obviously, once they called and the fit was good, we continued our work together. Okay, one final question. And then I'll start with Dr. Jeremy, because you are also a DBH like myself. If the public truly understood the role of DBHs in healthcare, what do you believe would change?
I think if the public really understood the integration of behavioral health and behavioral health in general, they would start to understand that the human is one holistic system, that what's happening in our brain is transferred into our body and vice versa. And we would start to see interventions, treatment that would be about holistic health rather than kind of symptom relief alone, kind of focusing just on a symptom that we're trying to remove, because that symptom is really the outcome. It's what happens after all the other stuff is moving around and churning in there, and sometimes for a very long time. So if the public could understand that behavioral health is really about holistic healthcare, whole person healthcare, I think we'd see great changes. And that is a messaging need, right? That is a marketing initiative that is important for all DBHs to pick up, which is to really be able to talk universally and consistently about what we as DBHs do together to provide holistic care, whole person care to patients.
Thank you for that answer. I love it. And so, Kat, I will ask you the same question, but from the perspective of a patient, because I know that you're not a DBH. So how do you think the public would, if you truly understood what a DBH does, how do you think it would change how you see healthcare or even engage with it?
Well, I think care will become more proactive rather than reactive, right? And at the end of the day, I mean, all the stats, everything proves that you have better outcomes all around, whether it's for patients, providers, and the whole system. I think you guys at DBHS don't just address the symptoms, you address the systemic drivers behind them. And so just being part of the system, if everybody knew who you are and what you can do for them, I think that would just improve care all around.
Awesome, thank you. I'm done with all my questions. I want to thank you both for being here with me today. I really appreciate it. I know it sounded like a little bit of a whirlwind there, but thank you so much for coming and agreeing to talk with me today. And thank you so much for sharing your insights and your expertise today. I really appreciate it.
Thank you for having me.
Thank you for hosting, Dr. Biglow.
If you enjoyed this episode, don't forget to subscribe and share. Let's keep disrupting healthcare together. Until next time.